Hello, everybody. Welcome to the Communication 24/7 podcast, where we communicate about how we communicate. I'm your host, Jennifer Furlong. Today, I wanted to switch gears. My thing is communication, and one important topic that I think is closely related to communication is the topic of mental health. In the communication genre, we know that words and our behaviors are closely linked to our perceptions of reality. And that will have an impact on how we view the world, how we view ourselves, our feelings about our identity, our sense of self worth, all of those things. So that's why today I'm very excited to introduce my next very special guest because he is an expert in this field and a lot of fields that are kind of connected, to the area of medicine and mental health care. So I'm going to do a quick introduction and then we're going to get this interview started because I don't want to waste a lot of time focused on me and me talking. This is really important. So I want to have our guest expert give him as much time as possible to spread the word and so that we can learn what we need to learn from him. So I have with me today in the studio, it's Dr. Carlos Yu. He is a psychotherapy, addiction medicine, integrative family medicine, emergency medicine, and travel medicine physician at Ajax Harwood Clinic. And so everybody who's in the United States, like I am, just so you know, that's up in Canada. So just so we know where everybody is situated right now. He holds a fellowship and emergency medicine certificate from the College of Family Physicians of Canada, consultant in travel health. He graduated from Schulich School. Did I pronounce that correctly?
That's
Schulich?
right. That's right.
Oh, good. Schulich School of Medicine. He also holds an applied mathematics degree from University of Waterloo. So, math, not my strong area by any stretch of the imagination. So, this is really impressive. Thank you so much, Carlos, for being on the show. I'm so excited to have this conversation with you.
Well, thank you so much, Jen, for for first of all, thank you so much for having being able to meet you at that meetup one day, right? Wasn't it about the
That's
podcast,
right.
about
Yeah.
how to make a
Yeah.
podcast? And there I'm th- there here we are. It's amazing. So thank you for the introduction. But I as for being an expert, I would say I'm just happy to have this opportunity to share what I've learned over the years of not maybe schooling, but really from being a family doctor for maybe
Mm.
30 some years now. And especially in the last 7 years, I've started to really decide to just say, I want to know, how do we target things, health challenges in a sort of a fundamental way? How do we like go deeper, go for the root cause? Is there something that we
Mm.
can do in there? I feel like a lot of what I have been doing in the past has been symptom management. So, anyways, that's how I started my journey about 5, 7 years ago, and here I am. So, I think of myself as somebody who has begun the journey to travel
Mm.
inward to discover what can I do, what is inside, what is really making me tick, what is making people tick. So to take that journey. So I feel like I'm more of a, I like to think of myself as a Sherpa for people who wants to
Oh.
take that journey inward, that expedition inside. It's an exciting place, but sometimes people, they come to a different place in their life where they suddenly realize it's time to do it. And I feel like it's a privilege to be there, to come along, maybe to follow, to witness the manifestation. Anyways,
Yeah.
that's my take.
No, I love it. And that's one of the reasons why I was excited to have you on the show today because you have such an impressive background in medicine and you're able to come from that aspect, of the topic that we're going to talk about today. And I noticed you mentioned that you felt like you were more or less treating just the symptoms of a lot of the things that you were noticing with your patients coming into your office. And that kind of, I guess, in your mind, did that prevent you? You're so focused on symptoms. And do you think this is an issue across the medical community? Are we so focused on symptoms that we're not really able to get to the root cause of a lot of the issues that are coming into the medical offices? What happened that made you notice that there needed to be a change, at least as far as how you're, moving forward with treating patients?
I think the biggest change for me personally is around 5, 7 years ago. I had um, I had a moment in my life where I decided, am I going to retire or I'm not going to retire? Right.
Mm,
At that point, I decided, you know what? I can let go of some of these issues I hung on to, paying mortgages and doing all this work. I felt like I had the space to be honest with myself. And I felt like there was things in my own life that needed some honest examination, like my own relationship, not just with my patients, sort of, am I helping them in a fundamental way, but also my relationship with my family, my children,
mm,
my wife, with myself. Am I being honest with myself? And I think at one point I decided to say, you know what? Life is too short to keep saying no. Say yes and
mhm,
and go deep and find out what's going on. I think that's where it started. I think it started with me trying to sort of go be honest with myself. And then you translate it to I started to say, oh, how can I make this happen? The medical healthcare system, its convention system is sort of set up in a way where it's kind of like a one-to-one interaction. There's very little time you have to spend with
mm,
patients. And for the amount of time that you have, you're dealing with symptom management. You're dealing with all the different guidelines out there. There's tons and tons of stuff going on. The prevention medicines. How do you detect early detection of cancers and all this stuff? There's so much to do. So I thought, I actually learned I went to an American conference and they had this physician sort of assistant whose title was a behavior consultant. Right?
mm,
Oh, well, that's brilliant. So what they do is they pair up in this system. They paired up the physician, the primary care provider, with a behavior consultant who actually spend the time targeting the root challenges. It's like trying to be healthy, knowing what to do is quite different than actually making it happen in those moments when we're stressed out. We got to get the kids food, and you just came back from work, and how do you actually manage a good meal? How do you end up eating properly when
mm,
we're stressed out? So my work went from emulating what I learned from one of those conferences. So I hired myself a behavior consultant. She wasn't
okay.
titled that, but I trained her that way. And then we
Mhm,
started running groups. We started to engage people in groups, not this one-on-one model anymore, because that's not effective. That's just not scalable. It's not necessary.
mhm,
And you lose out all the group dynamics. That can potentially make things even better. So we started running groups. We started to target sort of diet. We targeted exercises. Eventually, after a couple of years, I realized the real payoff. It's really the other piece that's inside, like the moment to moment awareness, how to teach people to live in the moment, to be present, so that they can use the skills
mm,
they have learned to apply in those moments when they're when in real life settings. So anyways, that's where we are right now. We focus our energy on working with, I call them mental. I guess I call it mental health, but I don't like to pathologize the experience no
yeah.
more, because I feel like everybody thinks there's something wrong. Fundamentally, no, there isn't really anything wrong. What it is that it's that inner judgment that we carry with us all the time, thinking that we need to be somewhere else that's taking away from the present moment. So I try to teach people how do we together come back to the present moment, to understand our own relationship with our thoughts, our emotions, and our sensation, how they interact with each other. So anyways, this is what I'm working on right now. It's ongoing. It's very exciting. So I won't go on because I feel like maybe I will let you guide the conversation a little bit.
No, no, I'm loving it
And
because
on.
yeah, no, I love it because I don't think there are many doctors, at least in my experience, and there could be a fair amount of doctors in the United States that are kind of going down this road, following the same trajectory as you are. But I personally, have not met any, and I haven't really come across any, so far. So I'm finding your explanation of your journey and how you've come to, doing what it is that you're doing with your patients and working in groups and having these discussions. And of course, a lot of that, it sounds like it's focused on communication and kind of like what I said at the beginning, the words that we choose to use, our perceptions can have a profound impact, on ourselves and our bodies. And the work that you have to do to be honest with yourself can be incredibly difficult. One question I do have is when you have these people come together in these groups and you start having these types of conversations to get to the root cause, do you ever encounter any resistance from them? Because I know that type of inward realization to really look at how you view the world and how you talk about the world and how you view yourself. And basically, that can be very difficult for somebody to come to terms with. Wow, I am creating my own problems, aren't I? Or maybe I'm not creating them, but I sure as heck am not helping them, with the language and the attitude and the perception that I'm carrying around with me. So what is that like?
Yeah.
Have you had anybody resist you in these groups in that way?
It's so interesting that you should bring this up. It's like one of the one of the most fascinating challenge of what I do is it's enrollment. It's like how do you engage people, right? So
Mhm.
so I've learned this one thing. I feel like I'm very humble by what I've learned. It's like I don't engage people. People come, right?
Mhm.
Like or maybe the universe bring us together. I think that's the best way I can
Yeah,
understand it.
yeah.
I don't I mean it's a I don't tell people to show up. People show up,
Right.
right?
Yeah.
So I think the messaging is so important. How do you make it accessible to people? Like
Mhm.
nobody wants to be told that when they're not ready. That is right. That
Yeah.
that they may actually be creating their own challenge in some ways or
Right.
not realizing. Because I would say I've been very lucky. I mean, I think the people seems to just show up at that door.
Mhm.
It's. I feel like the stars line up, and I think the best place to sort of the attitude that I take is that it's like I'm the Sherpa. I am basically the witnesser. Okay, I'm
Mhm.
basically privileged to have a chance to see the people who have chosen to take their own inward expedition. Somehow,
Mhm.
things have to line up for them. There's a whole combination of sort of constellation of stars have to line up. For example, they have to have, maybe tried different things that didn't work out for them. Maybe, talk therapy didn't work. Maybe, maybe medication just wasn't good enough, right? Or they have to feel the need, right? And then they have to realize that, oh, hang on, maybe the answer is not all outside. All those things that I can change, I changed, but there's something else, right? The things I can't change, I can't fight no more. But it's not okay like this. I need to go into the other direction. So I think
Mhm.
there's I think there's like a run. This I feel like there's a whole bunch of things happening. I look around the media these days. This thing called "How to Change Your Mind" by Michael Pollan, Netflix series
Mhm.
that's showing up. So people becoming more and more aware. I look at the internet. I look what's on this. Maybe it's just what I'm reading, but I feel like there's a lot of information out there
Mhm.
that's pointing people in this direction. So yeah, I don't. I guess to I think words are very important. I'm very careful. I frame myself in a way I don't want to be pushing this down anybody's. I feel like it's not my place, right? Because what do I
Right.
know, right? Some people have different paths. This may not be the path for them. They may be perfectly happy where they are, and who am I to tell them otherwise?
Yeah. Yeah.
I don't. I simply don't know that's true. That I should do anything different than just be invitational to maybe
Mhm.
be sharing to say, hey, this is what I've noticed. This is what helped me, right? And
Yeah. Yeah.
being a physician, I'm in the place where people, there's a lot of people who are suffering, right? So they
Mhm.
do come to me a lot, anyways, for different reasons. Sometimes I can point out to them, say, hey, there's this piece that you might not have looked at that may have an impact. Like, for example, if you want to quit smoking or quit something else, maybe the problem is not just the cigarette. Maybe
Mhm.
it's not even the alcohol. Okay, maybe that's just a symptomatic thing that you have found that to keep you alive to this point, to keep you coping, so that you can get the life going, keep on going. But you know what? Maybe there's something deeper we can explore, right?
Yeah.
Maybe it's
Yeah.
that sense of self-compassion we need to uncover. Maybe that sense of present, to be literally to live in the moment, to realize what overthinking is all about. And that is where we're really running away from, right? The overthinking,
Right.
the memories, the imaginations about things that hasn't even happened, the overwhelming emotions that maybe, it's that gift that we have that we don't realize, the gift of being
Mhm.
being able to connect in the emotional way. But some people is they become so overwhelmed by it and they pathologize it. They call it anxiety. They call it that
Mhm.
they think there's something wrong with themselves, and they add another layer of self-blame and running away,
Mm.
pushing. So by helping people come to the present moment to discover what's really going on, then they realize there's no problem to start with. It's all just gifts that they're struggling with. So this is sort of this is what I'm doing.
I it's not luck. I'm just thinking about what you said a few moments ago about the enrollment and how you really don't have to convince anyone to do this. You have people enrolling for this, and I can see why. This is not luck. Just listening to you talk about this healing process and just it for those who are not watching the video, if I could explain Dr. Yu's facial expressions right now, I can tell he is a compassionate person. He really cares about his patients, and he is open to looking at different ways to try to help a person heal themselves and just kind of being in the moment. So I think with people enrolling with you, it's not luck. I think after one conversation with you, I'm ready to be your patient. Like I'm ready. I'm ready for you
Like,
to kind of just help me, figure out, just like you were talking about, whether it's anxiety or if you think you have ADHD or, like we all have these labels. We all, like you said, we think there's something wrong. We need a diagnosis. We need something, and give us something to make this better. But I can see how your patients, after a while would be like, they trust you. They trust you. You have this aura about you that just exudes, that you're there to help them, not just address the symptoms, but to actually get to the core of the issue and help really transform. I'm sure, transforming their lives. Have you got a lot of responses like that from your patients who have taken this route with you? Have they had any huge realizations and now it's like all of a sudden they don't have that dependency on alcohol or smoking, because a lot of times I agree, I think a lot of times that's you're self-medicating, there's something else going on,
yeah,
that's why you're self-medicating.
I want to normalize the experience. Like people
Mm-hmm.
who feel suicidal, people who are using
Mm,
alcohol, people using drugs. I feel like they need to realize addiction is a common humanity. We all got some shit inside us, right? We just
yeah.
addict to different things. That's all, right? Some
Mm-hmm.
socially acceptable, some of it is not socially acceptable. But
Mm-hmm.
society is just a construct that we design. It is not
Mm-hmm.
absolute. So I tell them, look, good for you to have found the technique to help you cope to this point, but it doesn't
Mm-hmm.
stop us from looking further, right? Let's see if
Right.
there's anything else that we can do. And then we never talk about alcohol, we never talk about cigarettes, nicotine,
Mm,
but they do come off. They do get
yeah.
better. Like, so I so in an attempt, right, to reach out to the greater sort of community outside my practice, outside my referral sort of base, so I started this company. We started this company called Inward Expeditions. So we
Mm-hmm.
actually created a website. We just launched it in July. So
Mm-hmm.
in there, we're very lucky again. Okay, very fortunate. We have somebody who is very good, right, to put together like little video clips. of patient experiences, people with lived experiences who've gone through the process of the inward expedition, the inward journey, and they have there is their testimony of how
Mm.
they have transformed. So there are situations where I have patients with, let's say, bipolar, OCD, with people. I hate to use those diagnoses.
Mm-hmm.
Can you
Right.
erase that? I hate those words. But let's say people with overwhelming thoughts, who has been given labels in the past by the medical community, right? Those and they show how their experience are. They normalize the experience of actually having had the feeling of wanting to kill themselves, and say, look, I know now what was happening. It was a perfectly logical thing in my mind at the time, right? To have that feeling.
Right.
It's such a powerful when people can say that with with feeling okay without that self judgment that we carry, with shames
Yeah.
that carry. So those things are healing in themselves. So we created some video clips on this website called Inward
Mm-hmm.
Expeditions. And the idea is to invite people. Right now, we're only able to treat people sort of close to us because our process requires sort of one-on-one engagement.
Mm.
I'm hoping that, yeah, I just want to see if we can reach out to a greater, the greater community, because I feel like it's out of any given population, there's only so many percentage of people who are ready to take this expedition, right?
Mm-hmm.
So for us, if we can reach a larger group of people, right, then then of course you have more possibilities, right? So this is why I'm grateful that we are having this little podcast. I'm trying to get the word out there to to draw some attention to this process. It's not the only process. I think there's a lot of people doing absolutely wonderful work, right? This is just our thing, just my thing right now.
Yeah.
That's all.
Yeah, no, I think it's fantastic. And I absolutely think it is 1,000% needed. I mean, we can just kind of look around and yeah, I know in the United States and I have heard, from others that I communicate with, within Canada, there are just so many people who, for whatever reason, are hurting, and I know within our society, we feel like there's so much division, and there's so much hurt and there's so much distrust. And all of that weighs on you, after a while, you feel all that negativity in your body, you feel that level of stress. And then, of course, then we identify it as anxiety, or like you said, all the different levels. Young girls are on social media, and if they don't get enough likes, they feel like there's something wrong with them. So then their self-esteem begins to plummet, and they may begin having suicidal thoughts at one time, or another. And so I know people, even though we have so many people around us, so many of us feel alone, in handling these challenges that are coming at us. And I do appreciate several of the things that you said, and you made me realize that in my own journey, I do have one doctor in particular. He's my oncologist. In 2017, I was diagnosed with breast cancer. And so I went through, it was toward the end of 2017. So I had, I think, 3 surgeries and 30 rounds of radiation. And, then I was on hormone blockers, and I just stopped those about 2 months ago because I just couldn't take it anymore, with the havoc that it was wreaking on my body. Mentally, I wasn't in a good state. And I had a conversation with my oncologist, and I said, I'm paranoid about everything. I used the word paranoid. I said, every single thing I feel in my body, every time a bone aches or my joints are sore or I get a headache, I don't feel well, I'm paranoid. I can't enjoy my life because something happens and I'm scared to death, that the cancer is back, and I get frozen, and I use the word anxiety too. I get so anxious, I feel this level of anxiety. And he stopped me and he said, the first thing I want to say to you is, you have just experienced, it's a traumatic experience. You went through cancer, and there's a lot of things that you're still processing. You were in survival mode, now you're in recovery mode, and you're not paranoid at paying attention to the things that you have a legitimate reason to be concerned. So don't say the word paranoid. you went through something big. So you need to accept that, and understand it. So that really changed my perspective right there, just by him giving me, I don't want to use the word permission, but I guess maybe helping me realize that the language we do use and the labels that we use to describe our experiences, that can have a huge impact on how we're perceiving a situation. So he really empowered me,
Mm.
in a big way, to understand I don't have to use that word. There's another word. And now that word holds no power over me anymore, because now that I know, if I say paranoid, I'm like, well, actually, no, not really. I'm not. I'm not. I have a legitimate reason, to pay attention to my body, and listen to it, and then check in with it and see, maybe are there some things that I could be doing better in order to have a more positive outcome, whether it's diet or not being so sedentary, being in front of the computer hours and hours, on end. So I really appreciate, what you just said there about, just everything with the openness and the language and the labels, because that really does weigh heavily, on a patient. And it's so empowering to have a physician tell you, oh, there's a different way to look at this.
Yeah, well, I sensed that he was compassionate. He was
Hmm.
he was accepting, right? He did not feel
Yeah.
judged, right?
Hmm.
He normalized your experience. He says, let's not just throw a label on it and blame
Hmm.
ourselves for it, right?
Hmm.
So I think, fantastic job, well done, oncologist, whoever you are.
Yeah, yeah, yeah. And I don't even know if he intended that, but yes, I mean, it,
No,
it
he
made
was a
such a
human
huge
being
impact.
talking to a human being. It's logical.
Exactly.
Why are we
Hmm.
pathologizing everything, anyways? I mean, if I have been sort of, it's like a deer in the headlight, like if
Hmm.
I've been spooked, I'm going to double check. And that is perfectly legit. Listen, like I heard the
Yeah,
words you say, listen to my body. That was such an
yeah.
important concept.
Hmm.
It's like
Hmm.
it's like the answer is always somewhere in between, like the Buddhists say, it's not like paying attention, over paying
Yeah,
attention, and it's
yeah,
not ignoring it, because people tend to sway one way or the other. They become like
yeah,
absolutely every little thing they're checking, right? And they
yeah.
cannot be reassured enough. I mean, let's we can also talk about that too, limit, because that is also like a normal sort of thing. They just
Right,
have to understand why that happens.
right,
And the other end of the spectrum, people say, I just ignore everything, right? And like
right. Yeah.
during COVID, people did just that. They want to ignore everything. They, okay, nothing's
Mhm.
wrong. Okay, it's
Yeah,
like
yeah.
it's like those. It's like my parents would never buy insurance. They think they buy life insurance, they're gonna die, right? You
Right,
know,
yeah. They're putting something out in the universe that's going to cause it to
that's so
happen.
dangerous. Such bad luck. My house might burn down. No, I have fire insurance. You know, thinking, let's just block it all off. We don't want to know.
Yeah.
Ditch in
Uh,
head in sand. But somewhere in between is the right answer, right? But
mhm,
sometimes I do deal with people who overthink, because
mhm,
events in their lives that's traumatic leaves a very indelible imprint, right? So the
mhm,
body goes
mhm,
into this fight and flight and freeze
mhm.
and mode, right? The amygdala gets tuned up, and the part of the brain that generates thoughts, we call that, the scientists call that the default mode network. That part of the brain that's constantly just, it's like a Rolodex. Those old Rolodex
Yeah.
with thoughts.
Yeah. Oh, yeah. I remember those. Yeah.
You just keep flipping out old cards, right? It doesn't
Mhm.
matter if you need it or you don't need it, right? This is how the brain works, right? I mean, you can experience this for yourself for a moment. We can do this on the show one day if you want. We just
Yeah.
close our eyes. You can see exactly that's how the mind works. It just shows up. It's got a mind of its own. It just
Yeah.
comes up with thoughts after thoughts after thoughts after thoughts, right? And and so that part of the brain gets also super hyper activated. So that's
Yeah.
why people who's been through so-called very, very difficult events in their life, I would just hazard the word trauma, okay,
Mhm.
they end up overthinking, right?
Yeah.
For good reason. This is why a lot of
Mhm.
veterans, they come off the war, right? They're still like looking over their head, shoulders all the time. They can't relax. They can't cope with the emotions and the thoughts that's just colliding with each other. They totally get pulled off center, right? So they use drugs,
Yeah.
they use different ways to try to at least quelch things, to dumb things down, right? But that's just totally that all that is being further sort of fueled by like self-blame and guilt for not being there for their family. And they just,
Yeah.
what do, right? Becomes alcohol, drugs, whether it's legal or illegal, doesn't matter. They're just trying to
Hmm.
slow everything down. This is why, this is the renaissance of the uh, the treatments using non-ordinary states. What they talked about in the How to Change Your Mind in Michael Pollan's series there in Netflix is talking about
Okay.
how LSD was used once upon a time to help the soldiers back in the Vietnam War. Now they realize this is something we need to re-examine. Right? This is where
Mm.
we're at. We've come a long way from the days of just throwing people on Prozacs and stuff like that. We realize that's not going to necessarily get to the root of the challenge, right? It's symptomatic. Some people find their
Yeah.
way in spite of the drugs, but some people don't, right? How do you
Yeah.
help those people who don't? So this is so the idea that we end up overthinking and being paying extra attention to some degree is necessary, right?
Mm.
Because if somebody who's had history of certain type of illness, they're more likely to get it again. So you do have to
Mhm.
pay attention, and paying attention to your body is so important because then you end up doing the right thing for it. It's the over paying attention, right?
Mm.
That,
Mhm.
that is the challenge. So how do we stay in the center? How do we stay grounded? So this is the process that we help people realize, right? So two-step process that we use. The first step is to help people experience what is it like to live in the moment.
Mm.
This is not something that everybody has. Some people totally
Mhm.
lost it. Okay, they don't even know what it feels like to live in the moment again. All right, so show them what it's like. So there's different path, right? We explore whatever path that's accessible to the patient. And once they realize what is it like to live in the moment, right? So now we have to teach them how to get out into the world, right?
Mm.
Midst of all the triggers, how do you stay grounded, right?
Yes.
And
Yeah.
then once again, you got to find one that works for that patient, whether it's yoga, whether it's mind breath awareness training exercises. For some people, it might be just some exercise, physical exercise.
Mhm.
But the principle is important so they understand why they're doing what they're doing. Like a lot of people, I think, do yoga for fantastic health reasons, but they may not understand that the it under the most I would say a very critical component of, for example, something like yoga is the sensory awareness training. We need to ground
Mm.
ourselves in the body again so that we don't live up in the thoughts and the emotions only.
Right.
That's not centered, right? So we gotta at any given moment we gotta stay grounded. For example, you feel the seat pushing up against your body right now. That
Mhm.
is the sensation. That is what grounds us. The sensation of the breath, the sensation of your body, the temperature in the room, right? We become aware.
Mm.
The sensations, it can only be experienced in the present moment.
Mm.
Thoughts has the ability to take us away from the present moment. Depends what you think about, right? Yeah. If I am very much into thoughts about the past, suddenly it's as if I'm still in that. I could be living this moment, right? As if I'm somewhere else, right? Take me away from the present. And anyways, that's our process. So there, you got me going again. So I'm going to.
No, 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 no. I love it. That's why I'm not saying I am taking it all in, and it's making me think about so many people that a process like this can be so helpful. You mentioned veterans, and I think we're at what, 33 suicides a day with our U.S. veterans. Yeah, it's an absolutely um, terrifying number. And there are just so many veterans who are hurting throughout the nation. And nobody's been able to crack the code yet. It's been 33 suicides a day for ages now. And no matter how many programs are created from the VA, no matter what they do with the VA, no matter, it just seems like it's a number that continues to stick there. And it's just making me think there has to be a different way, there has to be a different approach to doing this. And I find it interesting that you had mentioned, back in the day, they were using LSD to get soldiers to, I guess, go under a different state of consciousness. And now it seems like we've kind of circled back to that.
Yeah, well,
Yeah, I read something about that in an article just the other day, which is interesting. That also links to, at least in the United States, we don't have nationally, there's not an agreement regarding, like the medicinal use of marijuana or the legalization or at least the decriminalization of marijuana. But yet you have so many soldiers, veterans who will say that's one thing that they have been able to find that has really helped them, to a certain degree. So it's an incredibly difficult and challenging topic to overcome. What advice would you have for a veteran who might, listen to this later on, and they're in that group where it's to the point that they're having those thoughts. It's dark, they're not feeling well, they feel alone, and maybe they are considering, where do they begin? How can they even begin to get out of that dark place?
well, this is what I would say, okay,
Hmm.
to this person. I would say, first of all, it's not an advice, okay?
Hmm.
Okay,
Hmm.
because what do I know about your situation, right? That I should feel like I could give you an advice. It's
Right.
not the place where I would come from. Okay, I don't feel like I could. But I would say what I have learned is that the greatest suffering for myself has also been the greatest gift.
Mm.
It's a very, very powerful invitation to move on to the next chapter of my life.
Mm.
And when I read a book, the first chapter is not the book. It's sometimes the second chapter is not the book either. It's when you keep going, then you realize that that first chapter, even though I didn't like it, in fact, I hated it, is what made the story beautiful.
Mm.
So
Hmm.
I would say it's an invitation to find out how things are. And I'm happy to talk to anyone who wants to reach
Hmm.
out to me. For me, I mean, I would say, um, I would say the solution is doesn't come from thinking about things.
Mm.
You, you see, overthinking is part of the challenge, right? I think most VAs who are who have challenge after the war, right? Who most veterans have challenge after war, they are gifted. Okay,
Hmm.
they usually are emotional, empathic people, like strongly
Hmm.
empathic people. They don't let go of emotions so easily, right?
Hmm.
Like they are because they're gifted, right? And they're
Right.
usually super bright, so their brain is super sharp. So this combination of things makes it much harder for them to sort of move away from that habituated conditioning
Mm.
of
Hmm.
thinking and feeling, right?
Hmm.
So sometimes that's why, like a powerful process is necessary
Hmm.
to loosen them up from that trap in order to move on to a place where they, within themselves, there's an inner wisdom within
Hmm.
every one of us that can write the next chapter of our life, right? To move
Hmm.
on, right? Until then, you know, the fact that we have been that you, right, have been sort of dormant, sort of thing,
Hmm.
in this stage, in this chapter. There's a reason too, but it's not known to us until we move to the next one.
Mm.
And there, then we can look back and see exactly why it happened.
Right.
So this
Yeah.
this is what I would say, and the answer doesn't come from trying to think our way out of it. Right?
Right.
We can't think our way out of it because we all know. Right? In fact, the mind
Hmm.
is always trying to think ourselves out of it. It's just even more thinking. So we're still not centered. We need to get down. We need to get grounded. Right? So there's two
Hmm.
steps. One is to feel like what is it like to be in that space when we're not trapping our mind and emotions only.
Mm.
So sometimes that's why a powerful process is necessary, right? So like I think there are opportunities now, and things like marijuana, even though it's illegal, people use it anyways, right? Things
Right.
like magic
Mhm.
mushrooms, people use it anyways, right? It's not
Mhm.
illegal, but but it needs to be used properly.
Right.
People has to have an understanding. Otherwise, I don't know that it's quite as effective. So
Ah. Mhm.
I think it's not quite as effective. I feel like that is the path for people who have that is a one possible path, right? I think
Mhm.
I agree. There's many. I don't know that's the best path. There's many paths. It's whatever is accessible to the person, but there is a path for you. I know there is, right?
Right.
That is
Right.
it's I think it's just to be open to the
Mhm.
possibility that there is within each one of us a inner healing wisdom,
Mhm.
and what is stopping that from happening, right, is being stuck in this thinking. So a lot of it is
Mm.
this letting go, be curious. I don't know. I don't have the right words that will take you there. All I can say,
Yeah.
I
Yeah.
don't pretend to do, and I just see that I know people. It does happen for different people, and it can happen for you, right?
Yeah. Yeah.
Be open. I think that's the only thing I would say. Be open to possibilities.
Right. Well, you said something very interesting, and it made me think about the marijuana use, or mushrooms, and a lot of people do use those as a way to cope with whatever pain it is that they're dealing or trying to manage. Um, but from what I'm understanding, I think there's a big difference between using a drug in order to try to um, bury the pain and not address it, mute it, if you will, versus using drugs as a tool to be able to center yourself and engage in that process that you're talking about, being in the moment, centering yourself, and then learning how to focus on what it is that you're doing right now in this moment. I see there's two completely different ways that people can use drugs, so I guess it really does come down to intent, right? What is the purpose? Am I trying to run away from something, and not just not think about it, but we know it's going to come back later on, right? It's gonna You can't stay numb forever. um, or am I using this as a way to open my mind, center myself, be in a place mentally and emotionally where I can just focus and be in the moment? And that would put me in a better position to be able to then think about ways to address what it is. Or no, I use that word think again. So how does that work? What is that piece between centering yourself, being able to focus yourself, and then moving on to the application part? How do we move on, from that, from step one to step two?
Hmm. So I'm just going to sort of what I'm hearing you say. I think you made a very important point
Hmm.
that medication could be used either as a sedation or
Hmm.
as a distraction, right, from the
Mm-hmm.
pain, or it could be used as a way to 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 shift us from that
Hmm.
patterned way of thinking and feeling.
Hmm.
In that space, we might, if we're open, right,
Right, right. Yeah,
curious about
yeah.
that new experience and ask themselves, what is it? Because sometimes people in
Mhm,
that state, they will have certain images come, and they're not
mhm.
always pleasant images. Sometimes it could be
Right.
scary images, right?
Mhm,
But they have to already have it within themselves, openness to be
mhm.
curious and to say, hey, what is the lesson here for me to learn, right?
Okay.
So,
Mhm.
so, so I think some medications, I think the psychedelic class allows them to get to that space.
Okay.
So I want to backtrack a little bit, give a little bit of a
Mhm,
sort of baseline information for people who maybe might benefit from this. Is that
mhm,
there's generally just three ways psychotropic agents can work, right?
mhm,
One, is their depressants. Many substances are depressants. For example, alcohol, right?
Mhm.
Benzos, opioids, right?
Mm.
Opioids, painkiller, but it's also a depressant, right? It slows everything down. So that's an effective way to escape mental suffering, right? If my mind is
Mm.
too much, right? My
Mhm.
emotion is just like overwhelming. Well, it'd be nice to take a break, right?
Right.
Sleep, right? So that's how it's used. That's why alcohol is so popular, and that's why
Mm.
addiction to opioids and benzos is like big, right?
Mm.
Okay, the second way psychotropic agent can work is their stimulants, right? Stimulants will be things like coffee, right?
Mhm.
Right? Nicotine is a stimulant, right? And it's lots of stimulants which have a prescription, right?
Mhm.
Right. So if you think about things like serotonin agents, dopamine agents, like like Prozac,
Mhm.
like Propion, like things like Wellbutrin, right? Used
Mm.
used to sometimes they're used to help people quit smoking, right? So they're
Mhm.
stimulants, and they stimulate, they increase the neurotransmitters in the brain, and then there are things like that we give to kids that's labeled with ADHD, things
Mhm.
like stimulants like Ritalin, that kind of thing. I don't know what words you guys use in the States, but like
Mhm.
methylphenidate and that kind of stuff. That's basically a stimulants. And then the illegal ones would be like cocaine, right?
Right.
Also,
Okay. Yeah.
so what they do is they also help people who are looped into these thoughts here, allows them
Mhm.
a little space where they can actually direct their attention to something they're interested in. Maybe party a little longer, maybe study a little bit harder, maybe focus on work, maybe focus on home, right? Maybe just get up and not scream, get out of bed, that coffee and have that little cigarette at
Mhm.
noontime when the mind is a little frazzled, right?
Yeah. Yeah.
Focus, right? Let me go out. I'll be back. Okay? And then, right? Why? How does a stimulant calm you down? Isn't that the paradox? No, it isn't. It isn't a paradox. What it does is allows your attention to be focused on what you want to do versus
Mm.
being pulled away by that default mode network, that
Mm.
thought patterns that comes back. The mind somewhere else, right? If
Mm.
I don't have enough ability to stay present. So stimulant is basically a pharmacological, a medicinal way to produce presence. Ability to
Mm.
stay present can be pharmacologically induced. However, still a drug. Your body eventually get used to it. And life
Right.
promises to empty up the triggers. Right? That is a
Mhm.
promise life for us. Right? So as the trigger increases, our ability to stay present, okay, has to keep up. The drug doesn't make us go up. The drug will take us here and will leave us there, right? And maybe
Mm.
a little bit because our body becomes tolerant. But life's triggers are going like this. Sooner or later,
Right.
drugs fail, right? That's why
Yeah.
people end up on two drugs, higher doses, another drug, right? People end up with all this list of drugs with side effects, and they start get all messed up, right? So
Mhm.
that's the failure of using just medicine, right? So
Mm.
the third type of psychotropic agents are what they call psychedelics, right? And they don't all work the same way, right? If you take
Mhm.
things like MDMA and things like ketamine, things like psilocybin, which is the magic mushrooms, or the THC in the marijuana, especially I think it's worth pointing out about marijuana. Marijuana has both factors. It's both a depressant, right, and a hallucinogen, right, and also a psychedelic. That's why this
Mm.
drug, it's not necessarily the best way to do a journey because it's too much
Mm.
present. See, in the journey, if when we go into a journey, we want to get away from that ordinary state of pattern, thought, and feelings to get into another space. So give the give that inner wisdom a chance to create our next narrative or next experience. So, but if I'm too depressed from this, if I'm like drunk or if I'm having like too much of CBD, too relaxed from the CBD oil, right? The agent, then I cannot actually witness what's happening. So
Ah.
see, the healing comes from being able to see, being able to
Mhm.
become aware of a new reality that I did not see before, that I was blocked from. You see, so that's
Mm.
why the psychedelic agents works. Right, that's how they work
Mhm.
differently. But they require me to have some openness to start with. That's why you see
Yeah.
sometimes people go into like LSD, they can have what's called a bad trip. But really, there's no
Mhm.
bad trip except the mind makes it so. right? The mind
Okay.
judges it as being a bad trip. Really, that trip is exactly the trip that he needs, right?
Right.
That's why the person has to be prepared. That's why the idea of having a Sherpa is important.
Yeah. Yeah.
Like I don't like the word guide, but they use the word guide. They use sitter, somebody who can,
Mhm.
you know, that that can help them say, hey, you know what, you're fine, right? Just be
Yeah.
curious. What does this mean to you, right? Let's write
Right.
a narrative together, right? What is this telling you? You're safe.
Mhm.
Versus people doing this at a rave party or something, and then either they get abused, or they get or they deem it to be, oh my god, I had an awful experience because they didn't feel physically safe at that place. You see, they didn't
Right.
have the right setting. So that's why the setting is very important for using psychedelics. So they simply just go say, hey, you know what, go ahead and use it. I feel like it's doing a disservice to the
Mm.
to the potential of what this sort of medicine can do. I think it is a medicine. It can help people journey, but it can also be used as an escape. Yeah, to your point. Like for
Yeah.
example, like mushroom, right? Generally, people don't have really bad trips with mushrooms, so they can just use this as a party thing. You know, I have a
Right.
week. I don't have to worry about my shit. I can. you
Yeah,
know,
let's just have fun.
I
Yeah,
can,
we're just
I'm not saying it's a bad thing either. Okay, I'm,
right.
I'm just
Yeah.
saying. I'm just saying, if you're with good
I
friends,
mean, we all need a little fun in our lives, right? You know, sometimes that can be a
let's
great
have some
escape.
fun. Okay, go ahead if you want to do that. I'm not. Yeah, I don't want anybody taking my license away or anything like that.
Right. But no, I think you are doing an excellent job at underscoring that while these drugs can be helpful in if you're open to it, right? And you understand what to expect and you're open to the experience and knowing that it's going to help you understand things in a much different way.
Mm.
It's and maybe that's why so many of the programs have not worked up to this point. um, specifically talking about veterans, and the rate of suicides every day, even for, let's say, people who have been sexually assaulted, or who have, survivors who have, undergone some type of really traumatic experience. I can see, take this, it'll help take off the edge, take this, it'll help, you relax. um, but beyond that, there's something else that needs to happen, and I think that is the void right there, that the work that you're doing, I think that's why it's so important, because I think you're a bridge between what the medical community right now is focusing on versus, okay, we need to take this a step further. I mean, it's all well and good, we're opening this up, but at the end of the day, where is this journey headed? If it's just, okay, use it to numb the pain, that's not really helping to have that person transcend to a different mindset. And maybe that is what's missing, in a lot of these programs. I don't know, but I do appreciate that you're a physician, that you're open, to thinking about what is this bridge, what is missing, and what are the things that we can do, to help create this. I think you called it a non-ordinary state of consciousness. Is that?
Yeah, a non-ordinary
Mhm.
state of consciousness. Yeah, that is not my
Mhm.
word. It's a phrase that's used, that it's the state to be, that it's that state where
Mhm.
we're not blocked by our own patterned thoughts, patterned
Right.
emotions. There's a whole pattern that we're locked into in what we call the ordinary state. Then the
Yeah.
non-ordinary state can be arrived at through many paths. So
Okay.
things like meditation, sensory training, meditation, like Wim
Mhm.
Hof does the breathing exercises, the holotropic
Mm.
breath works, right?
Mhm.
That was used. Of course, you can use ethnomedicine, like plant medicines, like psilocybin mushrooms, all very ayahuasca, and then there's the pharmacological ones like LSD, ketamine, the main
Mhm.
ones, and then things like yoga. Okay,
Mhm.
that is the at the root of what at the root of what yoga is all about. Is
Right.
actually it's about the body sensation being
Yeah.
grounded to the body, to be centered once again,
Mhm.
not to be pulled away by the busyness of the thoughts and the strong ability to emote, which is all beautiful things. I mean, none of them are
Mhm.
to be like, they're all to be venerated, like ability to think. That's why, I'm so excited when I see people who have so-called, experienced challenges, because these people are,
Mhm.
they are marvelous, like marvelous,
Mhm.
marvelous creatures. They have this, they're gifts. They have
Yeah.
gifts. They have incredible gifts. Like I always like the story of Forrest Gump. I said, look at Forrest Gump.
Yeah.
He's perfectly happy. You know what? He's blessed too. Okay, like
Yeah.
he's got his compass set by his Sally Field told him what to do, and that was good enough. He doesn't have
Right.
to think anything. Ping pong. Oh, I've run enough now. Okay, I'm turning home now. And that,
Yeah.
so
Yeah.
Forrest Gump, I love that movie. It's like but okay, I love him too. But I'm just saying, people who have the gifts, right? They don't realize
Mhm.
it's their gift that they've been called upon to handle a much much bigger task in a way, right?
Mm.
To be able to manage strong emotions. That's what makes people beautiful. These people are the most
Mhm.
loving people.
Mhm.
Often they feel so much. They're afraid to feel. They have to push away sometimes.
Yeah.
It's the thing.
Yeah. I will admit that I'm one of those people.
And
I've been in therapy for for quite some time, and I have this conversation with my therapist a lot. I am one of those people that I do for a variety of reasons, with my childhood and all things that are in the past. And you're exactly right. When you start thinking about the past, right, and then those feelings start welling up, and then you can't disengage from that thought process, and then you end up spiraling down. And so what do is you suppress all those feelings. Okay, I'm not even going to deal with this right now. But the problem is
okay, sometimes.
they're still there, but yeah, that's when you end up running the risk of exploding at some point down the road. So one thing you talked about meditation, one of the things that I've learned is, and you talk about being in the moment, even doing something like washing the dishes.
Hmm.
I have learned, I'm washing the dishes and I'm paying attention to the temperature of the water, how the soap is feeling on my hands, and just kind of going through that motion and rinsing and, all of that, just kind of being in the moment. And I have found that even just doing something like housework, I'm vacuuming this carpet and I'm noticing the little, the lint that's being picked up, and I can feel the vibration of the handle, in my hand as I'm pushing it, and I can feel the muscle in my arm. And so it's just tiny things that I think a lot of people don't realize. When you talk about meditation, it's not specifically, okay, you have to find a room in the house where it's dark and there's no noise and you just have to focus on your breathing, and then what happens if my thoughts run away with me. I think a lot of people feel that that is their idea of what meditation is, without considering what you've been talking about, regarding just being in the moment, focusing on what is happening in the moment, and focusing on your body and what's happening around you, and how it's impacting all of your senses. I have found that to be an incredibly helpful process when I can feel myself um, maybe a little stressed out, or you feel the anxiety or whatever. Um, so Inward Expeditions, is it inwardexpeditions.com?
.ca.
Okay, .ca. That's right. You're in Canada.
Well, no, I could have done .com. I don't know why I got .ca, but it would have
Okay.
worked either way.
Yeah, yeah. So I will make sure that inwardexpeditions.ca is in the show notes for anyone who's interested in going to your website and checking things out. I think it's incredibly important. I encourage everyone, if you are feeling what it is that we've been talking about, if any of this has reached you and you're kind of like, okay, they're speaking my language right now, I would highly encourage you to go to the website, inwardexpeditions.ca. Just check things out. But because you are in Canada, are you going to eventually hold groups online, or for right now, are you just holding, in-person groups?
Oh, I just gave you the link to the online group that
Okay, good.
we run every Monday to Friday.
Oh, wow. Okay.
So you're welcome to show up because
Yeah.
there's I don't like the words you meditation too much to people who are
Yeah.
new to the group because they already
Mhm.
have a judgment about what meditation
Yep.
is. They might say it
Mhm.
doesn't work for me. I've tried that. That was the worst
Mhm.
thing ever. So I don't use the word meditation. Once again, to your point,
Mhm.
word is so important, right?
Mhm.
So I
Mhm.
use sensory awareness training. In a way, nobody knows
Mm.
what the heck that means. That's good. That's a good place to start.
Yeah.
So at least they come with an
Yeah.
open mind.
Yes, yes, a blank slate.
Awareness training, like a blank slate. It's much easier
Yeah.
to work with. Otherwise, you have to like you don't even know when you got to the bottom of a knot, right? So
Yeah.
sensory awareness training. There's the thoughts, there's the
Mhm.
emotion that float us. I think of thoughts as the wind, the
Mhm.
emotion as a sea, right?
Mm.
And they interact, don't they? They make waves.
Mhm.
El Nino, the wind blows the current wave, the waves, ocean temperature can change the wind. They collide like this. And
Mhm.
then soon we get blown away because we're not grounded.
Right.
Sensation is the ground. So when I say sensory awareness training, you know how real estate, the three most important thing is location, location, location.
Yes.
When it
Yes.
comes to meditation, the three most important thing is sensation, 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 right?
Mm.
So
Okay.
two caveats that I find that people helps people to know. One is that when we do sensory awareness training or meditation, whatever you call it, don't try to chase your thoughts away.
Mhm.
That's the act of chasing away your thoughts, accepting a thought, rationalize a thought, push away a thought, are just more thoughts that you're not aware of,
Mm.
right? So we're trapped into it again, right?
Mhm.
So it's all about going back to the sensation. Once you catch your thought, go back to the sensation. And the second caveat, right, is sometimes people think they're going to sensation. They're not. They're going to thinking about the sensation.
Mm.
The trick. Anyways,
Mhm.
this is the kind of stuff we talk about when you come to class. If you're interested at all,
Yeah.
anybody is interested, just show up, and we'll look forward to meet you. And that's our little gig right now.
Yeah, yeah.
For now,
I
I
love
don't know
it.
about tomorrow, but
Yeah.
this is what we do.
Yeah, no, I think it's fantastic. So we got the website. Are there any other ways that anyone who would be interested in contacting you, do you have an email
I'm
address,
on website.
or are you on social media?
I'm on social media. I have a TikTok thing and so on. But you go on the website, you will be able to see us there. And then there's
Okay.
contacts, and then I got a TikTok thing, Instagram. I'm just like that young person, trying to make a mark in this world.
Yeah. No, that's amazing. All right, I'm gonna look you up. I'm looking you up. I'm gonna start following you.
Yeah, that's
Yeah.
right. Follow me. I just started 2 weeks ago. I had 1,000% increase.
Oh, nice,
I'm
nice. So
actually
I'm gonna
working
have to
hard
learn
to
from
reach
you because
there.
I keep being told I need to start TikTok, and I've been really hesitant. So I'm I'm gonna have to look at everybody else's
You're
and
doing
see how
great, by the
everybody.
way. I just want to say I thank you so much for sharing what you've shared, just being so honest and be so open and telling me all about all your life stories, little pieces here and there. I look forward to hear more one day. But and also your ability to stay grounded already is there. Like I was so happy to hear, cutting the vegetable, feeling the running water and doing
Mhm.
the housework and being present with the sensation. You see, you got it. And that's how you stay grounded. So, anyways, I just want to mention that. I feel like.
Oh,
Thank you
thank
very
you.
much.
Thank you
Good
very much. I
stuff.
have enjoyed this conversation, and we will have another one. We will definitely have
I look
another
forward to it. I
conversation.
look forward to it.
Oh, yeah, I'm looking forward to it as well. Is there anything else that before we leave today, is there anything else that you wanted to be able to emphasize or highlight, or was there a question that I didn't get to that you feel is really important for the audience to be able to understand?
I think a lot went through there, so I feel
Mhm.
like
Yeah.
I don't expect people to hear all of it. So
Yeah.
they're curious, follow along,
Mhm.
maybe look into it, not necessarily from here, but I just say, there's inner wisdom, be open,
Yeah.
and just like I was, and it worked for me.
Yeah. Yeah.
Yeah.
Absolutely. All right. Well, that is it for today's episode of Unscripted with Dr. Carlos Yu. I hope you enjoyed it and I hope you got a lot out of this conversation. I know that I did. You know, life is hard, it's difficult. We all go through all of these different challenges and different experiences. And, you know, I hope this is just one additional avenue that you're open to taking and just, you know, try it out. That's all that we can do, learn different ways to cope and try to get through all of these experiences. And, you know, hopefully this will be the one that works and, you know, it'll do the trick. I highly encourage everyone, you know, visit inwardexpeditions.ca. All right, everybody, please have a great rest of your day, rest of your week, rest of your life. And I will see you next time. Thank you so much. Bye.
Bye.